World Tuberculosis Day is an annual event observed on March 24 to raise public awareness about the devastating impact of tuberculosis on the health, social, and economic well-being of people around the world. Tuberculosis is an infectious disease caused by the bacteria Mycobacterium tuberculosis, which primarily affects the lungs but can also affect other parts of the body. According to the World Health Organization, TB is one of the top 10 causes of death worldwide and is the leading cause of death from a single infectious agent, surpassing HIV/AIDS. In 2020, an estimated 10 million people worldwide fell ill with TB, and 1.5 million people died from the disease. The theme for the World TB Day 2023 is End TB, Invest in Innovation. This theme highlights the urgent need for innovative and effective tools and strategies to prevent, diagnose, and treat TB, particularly in the context of the COVID-19 pandemic. The pandemic has had a significant impact on TB services, with disruptions to diagnosis, treatment, and care services, and an increase in TB-related deaths. Tuberculosis is a bacterial infection that primarily affects the lungs, but can also affect other parts of the body such as the kidneys, spine, and brain. TB is a serious and potentially a life-threatening disease, but it can be cured with proper treatment. The key to successful treatment is early detection, which requires awareness of the signs and symptoms of the disease. The most common symptoms of tuberculosis are coughing, which may be accompanied by sputum, phlegm or blood, chest pain, fatigue, and weight loss. Other symptoms may include fever, chills, night sweats, and loss of appetite. In some cases, TB may not cause any symptoms at all, especially in people with a weakened immune system, such as those with HIV/AIDS. Tuberculosis is spread through the air when an infected person coughs, sneezes, or talks. It is important to seek medical attention if you experience any of these symptoms, especially if you have been in close contact with someone who has TB or have traveled to areas where TB is common. Certain populations are at higher risk for tuberculosis, including people with weakened immune systems, such as those with HIV/AIDS, or those taking immunosuppressive drugs, as well as people living in crowded or unsanitary conditions. It is important for these populations to be regularly screened for tuberculosis and to take appropriate precautions to prevent the spread of the disease. One of the key challenges in the fight against tuberculosis is the growing threat of drug-resistant tuberculosis, which is more difficult and costly to treat and can lead to higher rates of mortality. The most common type of drug-resistant tuberculosis is rifampicin-resistant tuberculosis. To address this challenge, there is a need for increased investment in research and development of new drugs and treatment regimens, as well as improved surveillance and monitoring of drug-resistant tuberculosis. In addition, there is a need to address the social determinants of tuberculosis, which contribute to the high burden of the disease among marginalized and vulnerable populations. These include poverty, malnutrition, overcrowding, and poor access to healthcare services. By addressing these underlying factors, it is possible to reduce the incidence of tuberculosis and improve the health and well-being of affected communities. The COVID-19 pandemic has also highlighted the need for a coordinated global response to infectious diseases, including tuberculosis. The pandemic has demonstrated the devastating impact that can occur when global health threats are not addressed quickly and effectively. To effectively combat tuberculosis and other infectious diseases, it is essential to maintain and strengthen the efforts to invest in research and innovation, strengthen health systems, and improve access to quality healthcare services for all. This includes increased investment in the development of new drugs, vaccines, and diagnostics for TB, as well as improving the capacity of health systems to effectively diagnose and treat TB. On this World Tuberculosis Day, it is important for people to take steps to protect themselves and their communities against tuberculosis. This includes maintaining good hygiene practices such as covering the mouth and nose when coughing or sneezing and washing hands regularly. People should also ensure that they receive appropriate and timely tuberculosis testing, like sputum examination, X-ray and CT scan of chest, and treatment if they experience any symptoms such as coughing, chest pain, and fever. It is important to remember that tuberculosis is curable, and early diagnosis and treatment can prevent the spread of the disease and save lives. By taking these simple steps, we can all play a role in ending the tuberculosis epidemic. Dr. Bala, a multifaceted radiologist. Please do subscribe our channel, Medirox Bala. Thank you for watching this video. Check out our new video. Don't forget to subscribe our channel. Leave a like if you enjoyed.